Good afternoon, everyone. It's an honor and a privilege today to be joined by House Democratic Whip Catherine Clark, Frank Pallone, the once and future chairman of the Energy and Commerce Committee, who, of course, is the leading champion in the House Democratic caucus in the Congress for the health care of the American people. Certainly, Angie Craig, the top Democrat on the Ag Committee, who's doing a tremendous job. And, of course, Brendan Boyle, the future chair of the Budget Committee, who has been our point person on budget reconciliation. House Republicans are determined to jam a reckless and extreme budget down the throats of the American people that will enact the largest cut to Medicaid and the largest cut to SNAP in American history. Children, families, women, veterans, older Americans, people with disabilities, and everyday Americans will be hurt. These proposed cuts to Medicaid and SNAP are unacceptable, unconscionable, and un-American. Several so-called swing seat and moderate Republicans have indicated that they are opposed to these devastating proposed cuts to SNAP and Medicaid. House Democrats earlier today, led by Brendan Boyle in terms of the discharge petition, and Frank Pallone and Angie Craig as it relates to the underlying legislation, hands off Medicaid and SNAP, have given Republicans an opportunity to actually not simply talk about defending the best interests of the American people, but be about it. The discharge petition is now live on the House floor. All we need are 4 Republicans to do the right thing, stand up for Medicaid and stand up for SNAP so they can stand up for the American people, and we can stop the devastating cuts that Republicans are proposing to the health care of the American people, and cuts that would literally take food out of the mouths of children and families. Hands off Medicaid and SNAP. I thank Frank Pallone, Angie Craig, and Brendan Boyle for their leadership on this effort. All we need are 4 House Republicans to join Democrats in protecting the health care and the nutritional assistance of the American people. Catherine Clark.
Thank you, Mr. Leader. Thank you for all that you are doing on behalf of the American people. And let's just look at where we are. In just over 100 days, the president has already spiked the cost of groceries. Thanks to his tariffs, we have empty ports. And we're weeks away from those empty ports turning into empty shelves and even higher prices, making it harder to put food on the table, making it harder to see a doctor, making it harder to afford housing, all to fund tax breaks for the wealthiest few. It seems like the Republicans these days have 2 settings. 1, waste time, or 2, actively make things worse. This week, they're renaming the Gulf of Mexico to fill time while they finalize how to kick moms and kids and seniors off of health care, how to take food and school lunches away from the people of this country and our children. All of this poses a question for those House Republicans who like to call themselves moderate. Here's a chance for you, your friends, your fellow moderates, to show you actually care for your constituents. It only takes a handful of Republicans to stop this, just a few, to protect Medicaid and save working families from losing their health care and going hungry. Try asking them in the halls today, Let's see if they're ready to vote for the people they represent. And it is my pleasure to yield to Ranking Member Brendan Boyle, and we are so grateful for all the work in bringing this discharge petition forward.
Thank you. Well, thank you to Catherine, the next Majority Leader of the United States House of Representatives, and thank future Speaker Jeffries, as well as my colleagues Frank Pallone and Angie Craig, with whom I partnered a few weeks ago to introduce the legislation Hands Off Medicaid and SNAP. Today, I filed a discharge petition that right now is live in the House. 10 a.m. was proud to be the first signer. And as Catherine and Hakeem both mentioned, all we don't need 100% of House Republicans. We don't need a majority of them. We need 2%. 2% of House Republicans. And by the way, there have been far more than 2% on TV who have been saying, oh, no, I would never cut Medicaid. I would never cut SNAP. Not me. Okay, prove it. Right now in the House, you can go down there, take about 15 seconds, sign your name, and we can have an immediate vote to protect Medicaid and to protect SNAP. Because if that doesn't happen, Republicans have already voted in the House. Every single one of them but one voted for the largest cut to Medicaid in American history. And on top of that, the largest cut to SNAP in American history. And why? To help subsidize tax cuts for the top 1%. It is wrong, it is immoral, and it is bad economics. So, to those Republicans who, and especially living in Philadelphia, every election time I see a lot of TV ads. It is amazing how moderate suddenly some Republicans become at election time, every 2 years and every 4 years. Well, here is an opportunity to actually prove it not at election time, to make a real difference. Just 4 House Republicans can make the critical difference to ensure that Medicaid and SNAP are entirely protected. I'll close with this. This is not some abstract Washington, D.C. issue. 44% of my constituents in working class neighborhoods of Philadelphia that I'm proud to be from and represent, 44% are on Medicaid. My neighbors will have their lives deeply impacted in a negative way if these Medicaid cuts go through. We are doing everything we can to prevent them. And with that, I am now proud to introduce almost a neighbor from New Jersey, the past and future chair of the Energy and Commerce Committee, Frank Pallone.
Thank you, Brendan. Thank you, Brendan, and thanks to all our leadership and Angie and all of us involved here today. I'm going to take a cue from you. You said that you just need 1 or 2 from the 2%. Philadelphia. On the other side of the river, I have 3. And we could just use those 3 and maybe 1 more from Philadelphia.
Deal.
And we'd be there with the 4. And believe me, I'm trying to get them. I don't know how easy that's going to be. Look, I think it's clear to most of you that the Republicans are in disarray. On our way over, they were meeting this morning, trying to figure out what to do in the Energy and Commerce Committee. I saw one of them leave the room as we were on our way over here. And they're in disarray because many of them know that their constituents would be negatively impacted by these Medicaid cuts, whether it's in nursing homes or it's people who just lose their health insurance or people with disabilities. All of these things they're very well aware of are going to have an incredibly negative impact on their constituents' health care. But they all voted for this reconciliation bill that, as far as the Energy and Commerce Committee is concerned, says that we have to cut $880 billion. And there's no way to reach that. The CBO has told us no way to reach that without most of it coming from Medicaid. And, all 3 of my New Jersey guys have said at some point that they don't want to cut Medicaid. And so what we're saying is, great, here's the opportunity. You just go down there and you sign this discharge petition, and it'll make sure that Medicaid and SNAP is not included in the reconciliation bill. But, of course, they're probably not going to do that because they know that the reconciliation bill requires these cuts in order to achieve the tax cuts that they want to do for the very wealthy, for billionaires, and for large corporate interests. And so they're in a dilemma. we're going to make their dilemma easier by saying, just sign this discharge petition, and we'll be fine. Medicaid will be fine. SNAP will be fine. And it's kind of like, throwing down the glove. Here's your opportunity. Take it, and then we will believe what you've been saying. So I'm just, we're just going to keep this up until we get there, because we do not want to see these Medicaid cuts or these SNAP cuts that are so would be so devastating. And with that, I will yield now to the ranking member of the Agriculture Committee, who's going to talk about the SNAP cuts.
Well, thank you so much. It's certainly an honor to be able to stand with my colleagues here today, and an honor, Leader Jeffries, to be able to stand up for the Supplemental Nutrition Assistance Program in this country. My Republican colleagues, as you all know, have indicated that they want to cut $230 billion from the SNAP program. Doing that would roll back, just think about this for a minute. The SNAP program provides $6.20 on average to hungry Americans. That would roll that back to $5 at a time when the nation's food costs are out of control, and the president and this administration promised that this would be their #1 priority. This hasn't even risen to any priority within this administration. Now, the Ag Committee, my majority, and Chairman Thompson, they keep hoping and praying that the Senate will save them. Folks, the Senate's not going to save you. This committee is actually going to be asked, I believe, next week to cut more than $230 billion, because now they want to roll essentially part of the Farm Bill into reconciliation, which means they're going to have to cut even more from SNAP in order to achieve this. So let me be clear about all of this. Many of the ideas coming out of Republicans on this committee, just a 10% cost share, if they choose to move in that direction, is a $400 million a year hit to the state of Pennsylvania. It is $4.27 billion over the next 10 years. So my colleagues, they truly have a choice here. They've said that they don't want to cut SNAP benefits. And truly, I believe that Chairman Thompson does not want to. But I also believe that Chairman Thompson is going to be rolled by Republican leadership, is going to be rolled by the White House. If this administration truly cares about family farmers, let me tell you this. Cutting SNAP by $230 billion is a direct cut of $30 billion to farm income in our country. And that doesn't even include the money that goes into SNAP for the truck drivers who drive the food to the stores, the retailers, and especially in rural communities across our country who sell that food, and of course, the hungry Americans and Minnesotans who rely on that, which are principally 70% veterans, seniors, and children in our country. And by the way, SNAP already has work requirements. So do not allow my Republican colleagues to try to characterize this as anything but taking food out of the mouths of hungry children in our country. I have 4 Republicans in Minnesota, 4 Republican congressmen and women. Last week, I decided that I would go around the state of Minnesota and I would do town halls in each of their Republican districts. And I can tell you cuts to Medicaid and cuts to SNAP were 2 of the most concerning issues that their constituents raised to me, because they won't show up and do their own town hall. So I say to you, I'm not looking for 4 Republicans in this country. I'm looking for 4 patriots in this country. 4 Republicans, that's all we have to find. And folks, if we can't find 4 patriots left in our nation to put their money where their mouth is and sign on to this discharge petition, then that is a truly sad day in America and a truly sad day for the Republican Party. Thank you, and I'll turn it back over to Leader Jeffries for comments.
Thank you, Angie. Thank you, Frank, Brendan, and Catherine. Questions?
Thank you, Leader Jeffries. Republican Congressman Nunn, Van Orden, and Bacon have signed on to a point of order that aims to kind of accomplish similar to what you all are discussing here. Will you support that, and should members of your caucus support both?
Those three members need to support the discharge petition that has been filed because it's ripe. The point of order that those three Republicans filed won't ripen until at least 30 legislative days. It's not a serious effort. If the Republican speaker says he's aiming to get this done by Memorial Day, the only serious effort to actually stop Medicaid and SNAP cuts from going into effect is the discharge petition that is live now on the House floor, supporting the legislation that has been advanced by Frank Pallone, Angie Craig, and Brendan Boyle. Thanks.
If I can just quickly follow up, and then I have a question. Have you all, or will you all be reaching out to those three Republicans, given that they are similarly having the same line of thought? And I have another question.
We've been in conversation with Republicans throughout this entire process because more than a dozen Republicans, if not more, have repeatedly and publicly said they will not support a budget reconciliation that actually cuts benefits for Medicaid and SNAP. However, it's time for them to actually put their money where their mouth has been legislatively and support a bill that can actually prevent Medicaid and SNAP benefits from taking place. The 1974 Budget Impoundment and Control Act explicitly prohibited Congress from touching Social Security in the budget reconciliation process. This legislation would add to that prohibition Medicaid and SNAP. It's very simple, it's clean, and it's straightforward. And if just a handful of Republicans actually join this legislation, then we can stop the largest cut to Medicaid in American history from taking place and the largest cut to SNAP in American history from taking place.
And if I may, House Republican leadership has done a good job of trying to block any discharge petitions that you all have put on the floor because they've tucked it into rules. Republicans have voted to block you all from going forward on past paths. It's possible they could do it again here. How are you all thinking about keeping Republicans on notice through other measures or mechanisms if they do end up trying to block this discharge petition?
Well, listen, it's an all-hands-on-deck effort to make sure we protect the health care of the American people, as well as prevent Republicans from literally snatching food from the mouths of hungry children, veterans, and seniors. Now, Republican leadership continues to claim that they have no intention of enacting devastating cuts to Medicaid and SNAP, and so it's not clear to us why they would block an actual legislative effort to make sure that what they are saying actually takes place. Catherine.
Thank you. Just to answer this question, this is yet another CYA move by the House Republicans. And frankly, the American people are tired of it. You are seeing it in town halls. We're seeing it across this country. People do not want them to take away their basic needs, health care, food, school lunch programs, feeding our seniors, Meals on Wheels, in order to fund tax cuts. And what we see repeated is so-called moderates writing letters to the speaker saying, this is not good for my district, it's not good for the country, for people, but then turning around and voting for it twice anyhow. And so this latest resolution just falls right into this same, inauthentic action. If you actually want to take and protect health care in this country, and you actually think that this is terrible for working families out there to take away their health care and food programs in order to have tax cuts for the very wealthiest, then vote on it. Vote on it. Don't file something that becomes 30 legislative days from now. Let's do it this week. And let's get back to a process and talking about taxes that makes sense and is centered around families at home.
Oh, no.
Okay.
Thank you. The speaker has indicated that the GAO believes there's about $50 billion in fraud and abuse in Medicaid. What number, if you're looking at fraud and abuse, do Democrats think is okay to cut?
First of all, there's nothing close to $880 billion.
They argue that over the 10-year window, that would add up to 550 some odd billion.
Yeah, they're lying to the American people, but let me defer to Frank Pallone.
We did a report in the Energy and Commerce Committee that was based on these red tape requirements in Georgia and Arkansas, two states that experimented with it. And what we found was that overwhelmingly, hundreds of thousands of people, I think it was 80–90% of the people that would normally be eligible for Medicaid lost their benefits because of the red tape requirements. And no one, or practically no one, got a job, right? Because the people were already employed who were able to be employed. So this is not a question of numbers, right? I mean, they can make up whatever numbers they want and say, it's going to be 50 million, billion, or 100
It's not
billion.
their numbers, it's the GAO.
Well, I understand that, but what I'm trying to say is what my fear is, and I think maybe that's what you're getting at, is that they're just going to do these red tape requirements and say, oh, that'll hit up to $880 billion. It won't. It wouldn't be anywhere near there. But I think that what's happening now is they're in total disarray. They don't know what to do. They know they can't reach these numbers, and so they're probably going to say, oh, we'll have all this red tape, and somehow that's going to reach the number. But it's not. And the only thing that it's going to do is to make sure that most people who are eligible for Medicaid don't get it and lose their health insurance.
Frank, Brendan?
Yeah. So, Chad, just if I might, because this came up in our 12-hour Budget Committee markup, and after this, my staff will provide you with the details. GAO later did a revision of that GAO report, the initial report, and they revised that number significantly downward. They also said that this should not be, it's a little bit contradictory on their part, but they said this should not be interpreted as a definitive figure. But again, happy to provide those details because I know the Republican side kept quoting that $500 billion figure over 10 years, but even GAO is not standing by that.
Question also has to be asked, why are House Republicans jumping through hoops to try to cut Medicaid, the health care of the American people, and cut nutritional assistance? It's all in service of enacting massive tax breaks for their billionaire MAGA donors like Elon Musk. The simple approach here, mathematically, is just to eliminate the tax breaks that you're trying to enact as it relates to your extreme MAGA Republican donors. And then you don't have to consider cutting Medicaid. You don't have to consider cutting SNAP. You don't have to consider cutting educational or housing benefits that the American people have earned and have come to rely upon. This is all being done in service of rewarding their donors like Elon Musk. And it is unacceptable. And Republicans can't explain that rationally to the American people. And so as a result, they go to old reliable waste, fraud, and abuse. Of course, Democrats are open in every instance to try to make sure that the federal government is effective, efficient, and equitable. And to the extent that there's waste that can be found in any program, we're open to that in good faith. There is nothing close to $880 billion in waste, fraud, and abuse as it relates to Medicaid. There is nothing close to $230 billion as it relates to the Supplemental Nutritional Assistance Program. It's all phony. And it's all designed to try to justify massive tax breaks for the wealthy, well-off, and well-connected billionaire donors of the Republicans. And that's something that the American people have made clear they reject.
Thank you. Many of the Republican lawmakers who have expressed skepticism or criticism about the current potential cuts to, through the E&C committee, they have still, admitted they're open to some sorts of cuts. Are there members that you think you can talk with to sign this who are open to no cuts? Like, is that a viable path, finding 4 people who are open to signing this? Because most have said they're open to some sort of cut.
Yes, you have members, including one in New York, in the Westchester suburbs, who has said clearly and unequivocally he's not going to support any cuts to Medicaid benefits. Well, the easiest way to make sure that happens is to sign this discharge petition so that there's an up or down vote on the hands-off Medicaid and SNAP legislation, which takes an existing law, the 1974 Budget Impoundment and Control Act, with an existing provision related to Social Security, and simply extends that to Medicaid and SNAP.
Can I say something? I guess I'm getting a little angry. We're talking about Medicaid cuts, right? And we're saying you're no longer going to be eligible for your health insurance. What does that mean, right? It means I can't go see a doctor. I have to go to the emergency room if I get sick. And then what happens, right? That becomes uncompensated care. That person gets sicker. Ultimately, the federal government ends up paying more, and you have a sicker society. We're talking about real people here and real lives. This is just, they can play all the numbers they want and say this is what they say it's up to. The bottom line is it's going to make this country sicker, and it's going to mean more cost to the federal government or the state or to the other people that have health insurance. They're going to have to make up the difference for the uncompensated care. So these numbers game belies the reality of what happens when people lose their health insurance and their Medicaid.
I just wanted to mention, since rural development falls into the jurisdiction of the Ag Committee, folks are very concerned about the outsized impact in rural communities across our country to these Medicaid cuts, because a higher proportion of folks who live in rural communities across our country have Medicaid as their primary coverage. And so we are seeing inside our congressional office and inside the committee a revolving door of healthcare organizations coming through to tell us that there is going to be a drastic impact on rural hospitals if, in fact, these Medicaid cuts come through. And it's going to cause not just cuts to Medicaid folks, but all healthcare costs are going to go up, as Frank said, if Medicaid is cut by $880 billion. And in a scenario where we're literally talking about cutting food security for people and health care for people, how in the world is this going to make America healthy again? This is only going to make America sicker, and it's only going to hit the pocketbooks of Americans even more. So all of my Republican colleagues who represent incredibly rural districts across our country because of the mass gerrymandering in our nation, I have been talking to them and telling them publicly and privately that you really do have no idea the long-term impact in your communities. So many jobs in these rural communities come from our local hospitals and healthcare systems. This is going to be a shockwave through rural communities if they move forward with these plans.
Thank you. Last question.
Yeah, I just wanted to follow up on that GAO report. The more recent version has about $31 billion, if I recall, and about 80% of that is essentially documentation paperwork errors. That still leaves like $6 billion a year. They could be abusive or fraud. Is that the kind of thing Democrats are willing to look at, or is the reconciliation process just like too partisan and you can't even go there?
Well, the reconciliation process is hyper-partisan, and it's all being done in service of enacting extreme right-wing policy proposals that they want to visit upon the American people, in many instances doing great damage to the American people in rural America, or the heartland of America, small town America, urban America, and suburban and exurban America as well. we have made clear from the very beginning that we're interested in trying to find any bipartisan common ground to solve problems on behalf of the American people, including making the federal government the most efficient that it can be. We also want to bring about an affordable economy that actually makes life better for everyday Americans. Nothing in this reconciliation process is designed to actually solve problems for everyday Americans, improve the economy, or lower costs. In fact, what we see from Donald Trump and Republicans is that they actually are crashing the economy in real time, raising costs through their reckless tariff scheme, and driving us toward a recession. And on top of all the damage that they're doing relative to the economy, they want to jam this extreme budget down the throats of the American people that will take away health care and nutritional assistance, which is why we're just urging a handful of Republicans to join us on behalf of the American people so that Congress gets the message, hands off Medicaid and SNAP. Thank you.
Thank you.
Thanks, guys.
How was that full cam? Was it good? Cool.